You are tuned in to Let's Talk About Health with the Super Doctors, Dr. Amanda Flowers, Dr. Mark White, and Dr. Victor McCoy. Sit back, relax, and enjoy this presentation of Let's Talk About Health, where your health is your wealth, on AM 1580 WVKO The Praise, where we are the voice of the people.
Good morning, Columbus. Thank you for tuning in to AM 1580 WVKO The Praise, the voice of the people. Welcome to Let's Talk About Health. I'm Dr. Amanda Flowers in the studio today with two special guests, Dr. Jeff Rosenberg and Miss Lisa Mason, and we're going to be talking about overcoming pain to achieve life successes. Dr. Mark White and Dr. Victor McCoy are not with us in the studio this morning because they're attending the National African American Male Wellness Walk at Livingston Park at 760 Livingston Avenue. They'll be giving us a call pretty soon to let us know how things are going, and we want to encourage all of you out there to join them at the walk right after our show. Now, listeners, we're excited about our show this morning. We are blessed with a doctor who heard about our show all the way in New York, and he's calling in to bring some valuable information to us today. We want to welcome Dr. Jeff Rosenberg to Let's Talk About Health. Dr. Rosenberg is a leading nationally board-certified chiropractor serving the New York area for 22 years. Dr. Rosenberg treats neck pain, headaches, back pain, sciatica, disc herniations and bulges, stenosis, rotator cuffs, tennis elbow, golfer's elbow, carpal tunnel, and plantar fasciitis. And Dr. Rosenberg is one of the only doctors in the U.S. who is certified in 3 safe and gentle proven techniques to alleviate pain and end suffering so individuals can live their full potential through their body, business, and relationships. Dr. Rosenberg is one of the few doctors in the U.S. to work at the Ironman Triathlon and the Wall Street Decathlon, where he treated elite-level professional athletes to help increase their strength, endurance, and overall performance, and he's treated professional athletes from the NFL and UFC. Dr. Rosenberg is one of the only chiropractors in the U.S. to speak at Harvard University, and he's appeared on many media outlets across the world. Good morning, Dr. Rosenberg. It's a pleasure to have you in the studio with us this morning. Dr. Rosenberg, can you hear us? Good morning, Dr. Rosenberg. Well, while we get him signed up or everything situated to hear him over the air, I want to introduce to you our other special guest who is in the studio this morning. As we're going over conversations about overcoming pain to achieve life successes, we're excited to also welcome Miss Lisa Mason to Let's Talk About Health, a multiple sclerosis warrior who is using her experience to motivate lives all around her. Miss Mason graduated in the top of her class while also participating in the PEP Club, and she was the co-captain of her drill team. 6 months after graduation, Miss Mason eagerly enlisted in the U.S. Navy, where she was an aviation mechanical engineer working on cleaning and launching jets. After spending 1.5 years traveling with the Navy, Miss Mason was released with an honorable medical separation, soon to learn that she had multiple sclerosis, but she did not allow her condition to stop her life, and 5 years later she gave birth to a beautiful daughter who is now 9 years old. Miss Mason is an inspiration to everyone in her life and participates in a multiple sclerosis self-help group to motivate others with the diagnosis. Miss Mason is a very active member of Peace Missionary Baptist Church, where she's often found motivating and praying for others. She's family-oriented and brought her number one fans with her today, her mother, Michelle Moore, and her daughter, to provide additional insight about multiple sclerosis from a family perspective. Good morning, ladies.
Good morning.
It's a pleasure to have you in the studio with us this morning.
Thank you. We're glad to be here.
Thank you.
Thank you.
Well, listeners, one of the things that, we don't always realize is that multiple sclerosis involves an immune-mediated process in which an abnormal response of the body's immune system is directed against the central nervous system, which is made up of the brain, spinal cord, and optic nerves. Pain syndromes often come with multiple sclerosis, with 55% of multiple sclerosis patients experiencing clinically significant pain at some time, and 48% reporting chronic pain. And, you know, more than 2.3 million people are affected by multiple sclerosis worldwide, and it's 3.5 times more common among women. And so, Ms. Mason, can you tell us what impact has multiple sclerosis had on your life physically and emotionally? And Mrs. Moore, feel free to chime in at any time to provide additional insight this morning.
Yes, it definitely has impacted my life a great deal. Physically, emotionally, physically, I've realized, I'm not able to do the things that I used to do, like as far as driving, and sometimes I like to be like as active as I can be with my daughter, but a lot of times the heat affects me a lot, so I'm not really able to do as much as I used to be able to do. And sometimes, it was times that it did affect me mentally, because I kind of like fell into like a little depression, because when I first found out that I did have MS, I was just like, oh my gosh, I was just like, I can't believe this. And because it was just kind of like, I was just kind of always thinking of the things that, I'm not really able to do anymore. But with the help of my loving family, my daughter, my mother, everybody in my family helping me and keeping my spirits lifted up, which is the most important thing. But I'm actually doing well right now. I still go through some of my little, because like it affects my legs a great deal as far as keeping my balance, and my hands go numb, and it affects my vision. But I'm still able to do. And the one things I do, which is kind of important too, is I get to the gym as much as I can. So I'm very strong. I walk with a cane. Sometimes I need to walk with a walker, but I still just praise God for giving me the strength to continue to move around and things like that. So I'm actually doing quite well, and I'm just I'm to the point now, I'm just like, any problems, any situations I feel like I'm going to start having, I just just pray to my God.
Good. Wonderful, Ms. Mason. Thank you so much. And I want to let listeners know, give us a call this morning at 614-824-2139 or 824-2336. It's not every day. We have Miss Mason's whole family, her mother and her daughter, in here with us this morning to give the whole family perspective of dealing with this. And we don't have that opportunity all the time. So give us a call if you have questions for the family. Now, Dr. Rosenberg, can you hear us? Dr. Rosenberg?
Yes, I can hear you.
Perfect. Sorry about that. We got you disconnected in the beginning. I do want you to know we gave your entire bio, and everyone here in the station is really impressed by you. So we did your introduction. So thank you for joining us this morning, and sorry about the getting you cut off in the beginning.
Okay, it all worked out.
Wonderful. Well, pain is associated with a wide range of injury and disease, and is sometimes the disease itself. In fact, more than 1.5 billion people worldwide suffer from chronic pain, and the negative impact of pain has been found to span every age. With the growing addiction to painkillers in our society, it's important that we know chiropractic practices are drug-free, hands-on approaches to pain management that includes patient examination, diagnosis, and treatment. So, Dr. Rosenberg, can you tell us a little bit more about what is chiropractic, and what personal experiences did you have early in life that led you to pursue this career path?
Sure. Well, just to add on to what you said about with pain, pain costs the United States $500 billion in disability every single year, and that's lost time in production of work, people missing days at work, and just productivity in general. But to answer your question about how I got involved with chiropractic, as a young kid, a friend of mine, I was about 15 years old, had called me up and said, I have tickets to go see a concert tonight. Let's go see it. And I said, I don't think that's a good idea. I don't think my parents will let me go. And he said to me, well, guess what? I just got my driver's license. And I said, ooh, sounds like a good idea. But I don't know if I can tell my mother, because if I tell her, she's not going to let me go. But I had decided to go anyway, and we went to one of the best concerts. It was U2, and I had an amazing time. And after the concert, we drove home, and we were driving, and all of a sudden I heard a sound that I never heard in my life. And it was a car slamming on their brakes, and they hit us at around 50 miles an hour. And the agony of the accident itself, and also hearing my mother's voice in the back of my head saying, you shouldn't have done this, I don't know which one was worse.
Wow.
I went to the hospital. The hospital said there's nothing wrong with me. I was in severe agony. I went home that night, woke up the next morning, and my mother knew that something had happened because, number one, I got home at probably 2:30 in the morning, which she wasn't too happy about. And in addition to that, my clothing smelled like smoke, which I wasn't smoking, but everybody in the concert was smoking. So she knew I did something, and I couldn't even get out of bed. So after it took me probably 10 minutes to get out of bed, she took me to our family medical doctor, who said to me, as far as my back was concerned, nothing's broken, so I shouldn't be in so much pain. I said to him, well, maybe I can go to a chiropractor. And I just heard a little bit about chiropractic, didn't know too much about it. He said, no, you're too young to go.
And Dr. Rosenberg, I'm going to stop you just for one moment, because we have a caller calling in to ask us a question. So I'm going to let you continue the story. Caller, you're on the air. Do you have a question for us this morning?
Yes, I'd like to know if I've been taking different medications and been going back and forth to the doctor, and they really don't know what's going on. Is there a blood test that I may have to take to find out exactly, if it is that or somewhere other?
Dr. Rosenberg, do you know anything about that? Do patients ever come to you and have to get blood work to know the origin of their pain?
Sure. Well, as a chiropractor in New York State, I'm allowed to take x-rays. I could send somebody out to another doctor, or medical doctor, to refer them for blood tests to rule out any kind of abnormality that I feel may be out of my expertise. But there's different things to diagnose what may be causing your pain, such as an x-ray, a CAT scan, or an MRI, depending on what the doctor thinks is going on. So a blood test is not the only thing. An x-ray is not the only thing. Sometimes it's a myriad of a few different tests. What other things other than pain is your caller experiencing, if I could ask?
Caller, do you hear that? What specific symptoms and other things are you experiencing in addition to your pain?
Well, sometimes it's I'm real tired, especially going towards the midday. And sometimes I, can be walking and I would just all of a sudden, in the knee would give out, or I got numbness in my hands, or sometimes both hands.
Okay. Well, it could be many different things. It's impossible to diagnose somebody over the phone, just like it's impossible, to tell somebody what chocolate tastes like over the phone. It sounds like it could be a few different things, but what I would do is I would go to your general practitioner and ask them if you have to, within your insurance plan, if you have to go to your general practitioner, or possibly even seeing a neurologist, getting some testing done. If there's, if you're experiencing pain, you can also see a chiropractor and let the chiropractor examine you. There are things out of the chiropractor's expertise, or there are things that Hello. Are what's called contraindications, meaning things that the chiropractor shouldn't be working on you, then he should refer you out to another doctor. So there's many times that you can be treated by multiple doctors for one for one particular condition. But you might need to get some diagnostic testing. It sounds like you have a few different things going on, and if you're having fatigue during the middle of the day, one of the questions that I'd ask you is, what kind of food do you eat? What kind of fuel are you putting inside of your body that you're feeling that you do? Could you give us a general idea? You don't have to be super specific, but could you give us a general idea of what you're putting in your body as far as food?
Our caller actually hung up on the other line. So we do thank her for calling in and asking us questions this morning. But we have another caller on the line. Caller, you're on the air. Do you have a question for us this morning?
This is Dr. Victor McCoy. I'm calling from the African American Health Walk.
Hi, Dr. McCoy. How are you?
I am blessed. Having fun down here doing these blood pressure and cholesterol and, those types of screenings and stuff, and having big fun.
Good.
People get healthy.
Yes. Now, what all kinds of health screens do you have down there?
We have, I was hanging out with the ophthalmologist, the eye surgeon, and a couple of urologists, Dr. Mark. I'm trying to find him, but I guess he's in the walk now. He's kind of disappeared into the crowd somewhere. But really helping a lot of people to see what their numbers are in terms of their cholesterol, their heart rate, their blood pressure, pulse, different things of that nature. Just trying to help people get on track with their overall and general health.
Wonderful. And, you were talking about an ophthalmologist and a urologist and things. It's exciting. I don't know if you've gotten to hear any of our show today, but we have Dr. Jeff Rosenberg calling in from New York. He's a chiropractor in New York. And then we have,
beautiful.
Yes, and we have Miss Lisa Mason here, who is a multiple sclerosis warrior. And one of the things when I was reading about multiple sclerosis is that people can have some vision problems, and then there can be some bladder problems and things like that. So it's interesting that you mentioned those. It's really important that we all get our screenings done and taken care of.
Yes. As a matter of fact, I met a cardiac surgeon here, and he's the head of the new hospital in Springfield. And he's called the Salt Doctor. Mm-hmm. And, one of the things I'll say every week is sugar is a toxic substance. And, we'll talk from that perspective. Dr. Mark talks about the salt. He'll take the salt side. But this cardiovascular surgeon, I would like to bring him on the air at some point in the future. We'll talk about that. But he has this book that he's written, and the book is called Salt, Black America's Silent Killer. Mm-hmm. And I've got all of his information, so I would like to bring him on the air and talk, because it's very interesting when he talked about the salt sensitivity of a lot of African Americans and how the ones that were salt sensitive made it over on, let's say, the slave ships. And so that is part of and many who weren't, they ended up dying on the ship by the millions. But it's very interesting. I have his book. I'm going to read his book probably tonight. Okay. And but I would like to share that information with you. It's phenomenal.
Wonderful. Well, I'm looking forward to hearing it. And we do thank you so much for calling in this morning. And if you have people there who have questions for us this morning, please have them give us a call.
I will do that. And I'm sorry I'm not on the air. Well, I'm on the air now, but I'm sorry I'm not at studio with you today, but you are holding down the fort, and we thank you, Dr. Amanda.
Thank you.
Have a good day.
You too. Well, everyone, you're listening to Let's Talk About Health on AM 1580 WVKO The Praise, the voice of the people. Please join our show with your questions after this break by calling 614-824-2139 or 824-2336.
You are tuned in to Let's Talk About Health with the Super Doctors, Dr. Amanda Flowers, Dr. Mark White, and Dr. Victor McCoy. Sit back, relax, and enjoy this presentation of Let's Talk About Health, where your health is your wealth, on AM 1580 WVKO The Praise, where we are the voice of the people.
Welcome back. You are tuned into Let's Talk About Health on AM 1580 WVKO The Praise. I'm Dr. Amanda Flowers in the studio today with Dr. Jeff Rosenberg and Miss Lisa Mason, and we're discussing ways to overcome pain to achieve life successes. Give us a call with your questions at 614-824-2139 or 824-2336. And remember, the National African American Male Wellness Walk at Livingston Park is going on right now at 760 Livingston Avenue. Stop by today and pay a visit to Dr. Mark White and Dr. Victor McCoy. They are waiting there for you. Now, we had a couple callers call in, and Dr. Rosenberg, you were talking about your experiences and how you were linked up with a chiropractor when you were younger. Now, what I want to go into is pain, when it's not effectively treated and relieved, has a detrimental effect on one's quality of life. When pain becomes chronic, it goes far beyond a physical sensation and impacts your emotions, as well as interferes with every aspect of living. People who are in constant pain have difficulty concentrating. They can't remember, things as well, and they worry about not being able to work or get their daily activities done. It also affects your sleep and your appetite, so it makes sense that people get depressed, anxious, or irritable when they suffer a lot of pain. So, Dr. Rosenberg, can you tell us what are 3 safe, gentle, and proven techniques that will help alleviate pain and maximize the potential in your body, business, and relationships?
Sure, that's a great question. Thank you. Well, one of the things is that I'm one of the only doctors in the New York City area that's certified in 3 safe, gentle, and proven techniques to relieve your pain and let you live in your full potential in your body and your business and your relationship. And the first one is called Cox Flexion Distraction Technique. And Cox Flexion Distraction Technique is a marriage of chiropractic and osteopathy. And it is the only technique, non-surgical, chiropractic technique proven to reduce the pain from a disc herniation or a disc bulge. Most people call them a slipped disc or a bulging disc. And one of the things is that it also does is it also takes pressure off of the sciatic nerve. So a lot of people come in with sciatic nerve pain all the way down the leg, or numbness and tingling and burning. Some people get numbness, tingling, and burning, and weakness into their arms. And Cox technique has been proven to alleviate that. One of the other things that it also does is that it brings the spine into a full range of motion safely. And by doing that, you could decrease the spasms and the discomfort that people get from something called spinal stenosis, which is probably around like 25 years ago. You didn't really hear too much about people having spinal stenosis, but with the population living for a longer period of time, we're finding that people are getting spinal stenosis, which is a very fancy way of saying degenerative joint disease or arthritis, when the spinal column or parts of where the nerves are actually become arthritic and degenerative, and actually the spaces become smaller, and it causes a lot of discomfort. So that's one of the beauties of Cox technique. The other technique that I practice is called active release technique. Active release technique has over 500 different maneuvers, similar to massage therapy, except it's a much more advanced way of breaking up tissue for people who have a rotator cuff problem, carpal tunnel syndrome, where everybody's sitting there typing on their keyboards at work now, and not only at work but at home, or people using their smartphones and their thumbs are irritated and they get into numbness and tingling into their thumbs, the pointer finger and also the middle finger, as well as plantar fasciitis or runner's knees or torn meniscus or torn menisci. That's what the active release technique has been able to do, to break up the pain, the scar tissue, and moreover the suffering that people have. And one of the things about active release technique is it's the technique that's used at the Ironman triathlon, which is a 140.6 mile race. So when people come, when a lot of people come to the Ironman triathlon to do the 140.6 miles, and they see that tent that says active release, they're lined up. People are lined up to get care. Sometimes not only before the race, but 3 days before the race. Some of these people come there just to take a look at what the course looks like. Mm-hmm. And when they see that ART or that active release tent, they're lined up.
Wow.
And many times I'm treating some of these people 3 days before the race, and some of them are either high-level amateurs or elite-level professional athletes getting active release technique. And that's the gold standard technique for a lot of professional athletes, weekend warriors, or even anybody sits at a desk, for hours on end, constantly typing.
That's wonderful. And you know what? I'm gonna hold off on the third technique for just 1 second. We have another caller calling in. Caller, you're on the air. Do you have a question for us this morning?
Yes, I do. I would like to know, are there a certain particular type of chiropractor, or can any chiropractor do those different techniques?
Sure. That's a great question, and I appreciate that. There's very few doctors who do one of the three techniques that I had spoken about. I don't even know of any, and I'm not saying that there aren't any, that do all three of the techniques that I do. And there are different types of chiropractic techniques. It's one of the things is just like there's doctors who treat, for argument's sake, just kidneys. There's doctors who treat neurological disorders. There's different types of chiropractic techniques that chiropractors utilize. The reason why I do what I do is because my body was starting to just slowly break down just from the wear and tear of life, of sitting and standing and bending and twisting and turning. But there are also chiropractors who specifically deal with women during pregnancy. There are chiropractors who deal with treating families, even children. There are some studies that are being done with chiropractic and children. Now, do I specialize in chiropractic care for children? No, it's not what I do. Would I refer somebody out if they had a child who wanted to get chiropractic care? Sure. And one of the things is people might say, well, why would a parent want their child under chiropractic care? And the answer for that is chiropractic is great for pain, but the real truth is that there are studies to show that chiropractic helps actually facilitate your life. There are studies to show how the aging process and the difficulties that come along with that have been improved with chiropractic care. So if it can help with the aging process, what could it do for a younger child? I started chiropractic care at 15 against the wishes of my parents and my medical doctor. So there are different types of chiropractic care for different situations. So that is a great question.
Under what name would I look for that does the techniques that you do?
Sure. So
the
name, you can go on you can go to a website called www.activerelease.com, and you can find a chiropractor near you who's certified in that. And there's different certifications for active release. There's different modules you can go to. You can go for one for the arm, one for the legs, one for the back and neck, one for the nerves. There's advanced techniques. So depending on what you have, make sure that chiropractor is certified to treat the particular part. Just because you're certified in active release doesn't mean that they're certified to treat the specific condition.
Well, caller, I was going to say, caller, we absolutely thank you for calling in this morning, and we do hope that you continue to tune into our show every week. Now, Dr. Rosenberg, you were going to finish saying something there, and then I wanted you to quickly finish up your third technique as well, because Ms. Mason has some things to tell us about motivation and inspiration when we have pain.
Sure. So the other technique that I'm certified in is called Groston technique, and there are similarities and a little bit of overlap with active release technique, except the difference is this is done. There's 6 stainless steel surgical grade metal tools, and one of the things is everybody asks when they see the tools, do they hurt? And I always tell them it won't hurt me. But in actuality, there's very little pain associated with it, and the tools are meant to break up the scar tissue. And oftentimes, if I could actually close my window, turn the radio off, and just close the door to my office, my patients can actually hear the difference between normal tissue and the sound of the scar tissue. It has a much more, it sounds almost like sandpaper being ripped up. And patients are actually pleased to hear that sound. Of course, it solidifies in their mind like there's something there, and it wasn't just in my head.
Wonderful. Well, it's interesting that we talk about that and talk about these techniques that can help us, with our body, our relationships, and our professional careers. Now, multiple sclerosis can be an overwhelming challenge at times, so it's important that we speak out, encourage people, spread confidence to others. And Miss Mason, you have expressed with the emotional pain that comes with it and the physical pain that inspiration and motivation are keys for you to overcome obstacles. And Dr. Rosenberg is going to be excited to hear this because he is also a life coach, so he helps people with different things like this. So can you tell us this morning, what do you do to stay inspired and stay motivated with the multiple sclerosis?
Oh, man. Normally, what I do, because I sometimes I experience kind of a little bit of pain through my legs, pain and numbness through my legs and in my hands. And then I go through pain like it's like with my nerves on the side of my face. And oh gosh, it's just so terrible sometimes. But how I just can get through it is I'm always one to get on my knees and I just talk to God and I just pray like, Jesus, I know I can get through this. I know I can because I am a survivor, and I always say I may have MS, but MS doesn't have me. So a lot of times, like when I'm experiencing pain, a little pain through my legs, I kind of just tend to sit down and I just stretch. I stretch as hard as I can. And actually, when I do that, I have noticed that the pain doesn't seem as bad once I do that. And like I said, my family, my mom and my daughter, my dad, everybody helps me. And my daughter will come in and she'll always come in and say, you're a soldier, Mommy. You can do this. You can get through this. And I just pray because I know God is not going to give me something that I can't bear with. He's not going to put too much on me. So I have my little ways what really kind of helps me. Like a lot of times when I go through the pain and on the side of my face, I have to drink kind of warm water or warm teas, warm drinks. That kind of helps me with that. But when I go through, like I said, the pain with my legs, I have to sit down and I stretch, real good, as hard as I can. And a lot of times it kind of eases the pain and things. So it kind of really helps me. So, yeah, I just kind of just do that as much as I can and just stay motivated.
Wonderful. And Mrs. Moore, you are the mom, so you've been right here beside her side this entire time. What do you have to add to this?
Well, MS, affects the nerves, but I do want to say that emotionally, bipolar goes along with MS because they don't realize that they're in a depression, and sometimes their reality is not a reality. And sometimes she gets to the point because she's in so much pain where she don't want to eat or she don't want to drink. So you have to constantly understand, in order for her to build those muscles, she has to have something in her body. So we do a lot of insurers. Our pastor has a drink that is geared for MS called Fruities, and she drinks that. So when she can't physically eat, she at least drinks something in her body, because there's two key things with MS. You have to have a relaxed, stress-free life. Have to. Yes. Because it affects your nerves, affects everything. And then the other thing is exercise. And with those things, and then the help of a family, a strong family. My husband, Deacon Moore, we call him the strong arm because when she needs walking, or if I'm not there and he takes care of her, or her daughter, she can lean on her, or her sister, Renee Mason. So we all tend to be there to help her walk. And when she feels like she can't go anymore, then that's when we step in and we push her. Yes. Especially me. I will push her to the point where she's, upset with me. Yeah. But it works. It works.
Absolutely.
It really does.
And Dr. Rosenberg, do you have any experiences with or nutritional advice for situations like this, and how you can, things you can eat or the exercising?
Sure. Well, the first thing that I would recommend is, and I know that you guys are trying to do the best that you can with Ensure, but the first thing that I would recommend is to move away from the Ensure. Okay. Ensure is made in a factory with chemicals, and it has sugar in it. And the last thing you want to start doing when you have any kind of autoimmune or neurological disease is eat anything with sugar in it. Sugar actually forms tons of other hosts in our gut that really does not serve us in any single way. My recommendation is, if you have MS or really any disease, or in actuality, for all human beings, we should really be moving away from products like Ensure. If you read the label of Ensure and you take a look at it, it has corn syrup or sugars in it that are really not serving you. Okay? And the other thing is, I would move towards a diet of things where when you look at the label, you could read it. You don't have to have a PhD in nuclear physics to read that. Okay? When you go to the supermarket and you're trying, health is something that comes from within us. And yes, of course, there's sources from the external that we need to make us healthier. But greens, things that alkalize our diet, things that raise the pH of our blood so that our body is functioning in a better way, so that we're living in a more holistic way. When you're putting in preservatives and chemicals into your body, especially if the body is not doing what we're supposed to be doing, we are supposed to, our bodies are constantly trying to live in what's called homeostasis, and that's a state of balance. And when we're eating foods that were made in accordance with the same intelligence that created us as human beings, not something like Ensure that was made in a laboratory, our bodies are going to do much better.
That's valuable. That's valuable information. Dr. Victor McCoy, who called in from the walk, would be excited right now, so I have to say his line. Sugar is a toxic substance. He tells us that every week, so he would have been thrilled to hear that, Dr. Rosenberg. Well, everyone out there, you're listening to Let's Talk About Health on AM 1580, WVKO The Praise, the voice of the people. Please join our show with your questions after this break by calling 614-824-2139 or 824-2336.
You are tuned in to Let's Talk About Health with the Super Doctors, Dr. Amanda Flowers, Dr. Mark White, and Dr. Victor McCoy. Sit back, relax, and enjoy this presentation of Let's Talk About Health, where your health is your wealth, on AM 1580, WVKO The Praise, where we are the voice of the people.
Welcome back. You are tuned into Let's Talk About Health on AM 1580 WVKO The Praise, the voice of the people. I'm Dr. Amanda Flowers in the studio today with Dr. Jeff Rosenberg and Miss Lisa Mason. We're discussing overcoming pain to achieve life successes. Listeners, give us a call with your questions at 614-824-2139 or 824-2336. Our time is winding down. You know, we have a lot of great information with us here in the studio today, so you'll want to take opportunities of that and give us a call about your managing your pain, going to see a chiropractor, what to do if you have multiple sclerosis. And remember, the National African American Male Wellness Walk is at Livingston Park right now at 760 Livingston Avenue. You can hop in your cars right now and listen to the show on your way to the park, so we want you to make sure you go there. Pay Dr. Mark White and Dr. Victor McCoy. They are there waiting for everyone to come. Let them know that you tuned into the show this morning. Well, when as with all, we have a caller on the line. Caller, you're on the air. Do you have a question for us this morning?
Hello, Super Dr. Amanda Flowers. This is Lady Joanna Thomas. How are you?
We're doing great, Lady Thomas. How are you?
I'm good. This show is fantastic. Dr. Rosenberg is sharing a great amount of information that is really blessing my heart. But I have a question specifically for him regarding chiropractic and lymphedema, specifically truncal lymphedema. Is that something that survivors could benefit for those that may be experiencing lymphedema in the chest wall, the arms, those kind of things? I'm going to hang up so I can hear the response to the question. But thank you. Great show.
Yes, and thank you for calling in. And Dr. Rosenberg?
Sure. Okay. To answer that question, there are many different techniques to help drain the lymphatic system. I've had patients come into my office.
I'm sorry. That was Lady Thomas. She hangs up so she can listen over the radio.
Okay. Okay, no problem. I've had patients come into my office post status, like, for things such as rotator cuff tears and surgeries or fractures, and after not having moved their arm for quite some time, everything is very swollen. And from doing some of the techniques that I've done, not only have I been able to decrease pain, increase their range of motion, but the swelling, we've been able to drain out a lot of the swelling or the edema out of their extremities. So, yes, absolutely.
Wonderful. And we want everybody to know that Lady Thomas has a car wash going on right down there at the Truth Church this morning. When I pulled into the studio, she was out here putting out signs. So everybody go to 1500 Barnett Avenue from 10 to 12 today and get your car washed. It is a free car wash, but I will tell you what, they do accept donations. So if you would like to donate to them, they would greatly appreciate that. Now, Dr. Rosenberg, as with all tracks of healthcare, a number of myths have taken on a life of their own when it comes to chiropractic care, but accepting such myths in the place of true facts can be someone's very own barrier to receiving the treatment they need to have a good quality life. Can you tell us what are some of the myths about chiropractic, and what do we really need to know about it?
Sure. Yeah. Well, one of the first myths is that chiropractors are not doctors. And the truth is that we are not medical doctors. In other words, if somebody comes to me, I don't give them medicine or I don't perform surgery. But the real truth is that we are doctors. We're doctors of chiropractic. We're licensed in every single state in the country. We're recognized by almost every single insurance company. We're recognized by our malpractice insurance coverers who cover us for chiropractic care. By personal injury, we have personal injury coverage. So if you get into a motor vehicle accident, in some states it's no fault, it covers chiropractic care, as well as workers' compensation. If you get hurt on the job, there's chiropractic care. So yes, we are doctors of chiropractic. We're just not medical doctors. So different terminology, but yes, we are doctors. That's one of the myths.
Yes. And we have a caller on the line. Caller, you're on the air. Do you have a question for us this morning?
Yes. If I have lipodema from the waist down, what would I be able to do about it?
Well, are you being treated for any conditions, or do you have any cardiovascular conditions? Like
maybe elephant legs. The fluid is just collecting in the legs from the waist down.
What I would do is, it sounds to me, and again, this is over the phone, so I can't see you. I don't know what color hair you have, but right. I would go to, if you're getting it in both legs,
yes,
I would recommend that you would see a cardiovascular specialist and just make sure that there's nothing going on with your cardiovascular system, and he may even refer you out to a vascular specialist just to make sure that there's nothing going on, like with the veins, below your heart or going into your legs. That's what it sounds like to me. So just get that checked up. It could be something, it could be nothing, or it could be something that needs to be taken, have somebody take a look at. So that's what I would do.
Okay. In the meantime, is there any exercises to try and, surpass that to control some of the pain?
Yeah, I think if you're getting swelling in both of your legs, what I'd recommend, get it checked out first, because again, it's not the most common thing for somebody to have what you're saying, and yeah. I would recommend. I feel better knowing that you had it looked at and ruled out by a medical doctor. Let him take a look at it. Let him refer you out to another specialist if he feels that it's not within his realm of expertise, and let them say, you know what? No, there's nothing going on there. Go and do your exercises. That's what I would, based on what you're telling me, I would have that looked at first.
Okay. Thank you very much.
Thank you, caller.
You're welcome.
And you have a good day, and we hope that you continue to tune into our show. And Dr. Rosenberg, you were talking about some of the myths.
Sure. So some of the other myths are, I've heard people say chiropractors could mess up your spine. And the real truth is that we actually unmess the spine. the safety record of chiropractic is unlike any other healthcare professional. Our record is so safe that if you go online and look, that it's very rare that you see that somebody has been hurt by a chiropractor. Now, I'm not going to say it never has happened. There are rare cases, and depending on who you ask, it could be 1 in every 4 million or 1 in every 5 million people that could have what's called a cerebrovascular accident, and that's also a mini stroke. Now, I'm not going to play on words and say I'm going to minimize a mini stroke, but most people who have a mini stroke usually recover from those. Now, if I was the chiropractor that caused something like a mini stroke, it's obviously not a very pleasant thing to happen, but that's a pretty good safety record, 1 in every 4 to 1 in every 5 million. And the fact of the matter is if we take a look at malpractice rates, my practice insurance is less than $2,500 a year. So that's indicative of the safety record of chiropractic.
Wonderful. And we have a caller on the line. Caller, you're on the air. Do you have a question for us this morning?
Yes. First, I want to give kudos to our chiropractors. It's going to Divine Chiropractic Service over on Parsons.
All right.
From the Cayman Islands. And I had 2 herniated discs from my job, and I thank and praise God for her because she straightened a whole lot of things out till I was diagnosed with pancreatic cancer. And is it safe for me to go back since I'm a year, this month I'm a year past the 3 months they gave me to live. And I'm pretty much back on my feet, and I'm just wondering if it's safe for me to go back and get work on my back because I'm noticing that when I have any bowel problems, my back hurts terribly. And I am on a mild oxycodone a pain pill. But
Sure.
Is it safe for me to go back to her? And what the young lady has on it now, I don't know if I was trying to understand it, get an understanding of what it is. Chiropractic won't help her? Or me?
Which particular lady are you talking about, sir?
The young lady is on there with either muscular dystrophy or whatever.
Multiple sclerosis.
Multiple sclerosis. Yes.
Yeah.
Well, I'll answer each one of your questions. The first one about multiple sclerosis. I do not believe that chiropractic care is going to cure.
Not cure.
Yeah,
Right.
no. But I just want to give you a wide answer for that. Nor do I believe that chiropractic can cure anything. Chiropractic doesn't cure anything. It's your body that heals itself. We just facilitate it.
Yeah,
okay?
right.
Now, that said, I have had, not many, but I have had patients come in with multiple sclerosis, and they have reported that it has helped them ease their life. Now, did it get rid of their symptoms and changes with, intermittent blindness? And no, it hasn't done that, but it's given them more quality of life. Now, as far as your answer, if you've been given a clean bill of health, I see nothing wrong with going to the chiropractor for multiple reasons, and I'm going to answer your question on multiple levels. Number one, if you've been given a clean bill of health, why not go back to the chiropractor and let her give you some relief? Number two, Cancer Centers of America have chiropractors that work there, along with the oncologists, along with the nutritionists and life coaches that they have to keep your spine in alignment. When the spine is in alignment, the rest of your body functions much better. Okay. The other thing is that chiropractic has a safer record than the medication that you're taking. So if you're taking the medication and the medication that you're taking is for pain, you may want to consider weighing out which is safer for you, the chiropractic or the medication. Now, I can't sit here and tell you not to take medication. That's not my job. I'm just here to show you that there are other answers out there, and chiropractic is being utilized at Cancer Centers of America. So I think that really stands and shows a lot about about the safety and efficacy of chiropractic care.
It does. And caller, we absolutely thank you for calling in this morning, and we hope that you continue to tune into our show. Now, as we talk about multiple sclerosis, the cause is not always known, and it's believed to be an autoimmune disease in which the body's immune system attacks its own tissue. And as we struggle to determine why multiple sclerosis develops in some people and not others, we know that a combination of factors ranging from genetics to infections to environmental factors may play a role. Now, Miss Mason, we have like probably 3 more minutes left this morning, so we just want to hit on the key things. But when you were in the Navy, you first started experiencing symptoms of multiple sclerosis. Can you tell us what you were going through and what life was, like afterwards, trying to get your military compensation put together?
Yes. The first things I started going through when I was in the military, it started with both of my hands going numb. And then like immediately after that, I started noticing that both of my legs, first it started with my right leg, but then it got to my left leg too. But both of my legs were kind of numb, and it was like hard for me to keep my balance as I was walking. So then that's just when I noticed like my vision, my eyes started moving really fast, like back and forth, to the point like if I'm sitting here talking to somebody, they would actually be like moving like back and forth. And I started experiencing all kind of crazy symptoms because of the job that I had. I was in AME, and I worked like in a line shack. And what my job was I launched jets, FA-18s. I launched and fueled them and painted them, sand them. I mean, the whole 9 yards.
And Ms. Moore, can you tell us about quickly the challenges you went through in trying to help her get the compensation through?
Yes. There was no guaranteed reason showing that why she got MS and if it was linked to the military. So what we then learned later was that when she was sanding the jets, that metal is what got into her body. And that was the cause. A lot of times, and she would start falling a lot if her equilibrium was off.
Yes.
And then the vision would stop.
And one thing I want to say is, because I know these guys, they fought for 5 years to make sure that she got her compensation through. So we just want to encourage people and let you know to, fight for that. And Dr. Rosenberg, can you let the listeners know how they can find you?
Sure. The best way to find me is you can go on to www.rosenbergwellnesscenter.com.
Wonderful.
And for your listeners, if they send an email to if they send an email to Jeff, Jeff, at DR for Dr. JEFF.NYC for New York City. So that's Jeff at drjeff.nyc. If they send me an email stating that they listen to the show, and if they, I will send them a video on how to stretch and strengthen their back.
Wonderful. Thank you so much. Well, thank you, everyone, for listening to Let's Talk About Health on AM 1580 WVKO The Praise. Tune in next week as our doctors talk with Dr. Todd Goldman about non-surgical ways to treat disc herniation. In the meantime, stop by our National African American Male Wellness Walk at Livingston Park at 760 Livingston Avenue. Go get your car washed at 1500 Barnett Road at the True Church. And stop by our studio here at 3360 East Livingston Avenue, Suite 2A, and show your support by giving a donation. And remember to look on our websites and everything. Everyone, remember, your health is your wealth. Let's talk about health.
Thank you for listening to Let's Talk About Health, where your health is your wealth, with the super doctors, Dr. Amanda Flowers, Dr. Mark White, and Dr. Victor McCoy. Join us every Saturday morning at 10 a.m. to 11 a.m. on AM 1580 WVKO The Praise, where we are the voice of the people.